If somebody already has Alzheimer's mild stage, what are the best interventions by impact? Diet first or fitness first?
It's all about the biological principle of synergy. So 1 + 1 = 3. There was a guy named Dr. Kottman did amazing studies, probably a decade ago, maybe less, where and I'm paraphrasing because it's been a while since I read the study, but they had dogs and they gave the dogs a very specific diet that was like, brain healthy. And they had the dogs that just ate the brain healthy diet versus the dogs that could exercise more and together and they could socialize. So the biological principle of synergy suggests 1 + 1 = 3. When you add in diet alone, okay, well, that gives one effect. When you add an exercise alone, that gives one effect. But when you add an exercise and diet together, and plus socialization and plus all these other things, it just kind of ramps everything up to have a much stronger beneficial effect. So to me, I don't like choosing one over the other, but I think the body of evidence actually does suggest that exercise on a regular basis, exercise lowers amyloid levels in the brain. Amyloid is the pathologic protein that builds up in the brain of a person with Alzheimer's. I think the evidence is stronger for exercise, but you can be exercising all you want. If you're not having enough carbs and protein around the time you're trying to build muscle, you're not going to build muscle. You can exercise all you want, but if you're eating like ice cream before bed and it has trans fats in it and it has lots of fat and like you're not getting the right nutrients, you have to do the right exercise, steady state cardio to zone 2, lower intensity to try to lose body fat, strength training because you need to build muscle, maintain muscle to have adequate metabolism. You build in together an exercise plan that focuses on the individual things that person is trying to work on. And then you have the nutrition to give the fuel to make things work better. And then you do everything else. That's how you reduce risk of Alzheimer's. That's how you prevent, in an ideal world, Alzheimer's. 45% of cases of dementia may be preventable if that person does everything right. And that's what we're shooting for here.